Hi, Dr. Don Hayes, DC here for EndFlame. What's EndFlame? EndFlame is a patient-administered, at-home finger-stick blood test that provides you and your healthcare provider valuable information on your immune system and the body's ability to stop inflammation. Your EndFlame program includes your initial EndFlame blood test kit that contains everything that you need to measure and start improving your cell health. At home, you'll conduct a simple, painless finger stick blood spot test that identifies specific fatty acids in your cells that are essential to the health and function of your entire body. All you have to do is follow the step-by-step instructions to collect your sample and then mail it to the lab in the prepaid return envelope in the kit. In approximately 5 to 10 days, your healthcare provider will receive a comprehensive 3-page report that measures your current cell health. You'll be scheduled to consult with your provider to receive guidance on the best way to proceed. Now, much of the research that led to the development of the EndFlame test was due to one person, Dr. Charles Sirhan, a professor and scientist at Harvard Medical School. Dr. Sirhan holds 200 biochemical patents and is the person who discovered a genetic hormone-like molecule in the blood that he named resolvins that are responsible for turning off inflammation and promoting tissue repair. He also discovered in order to make resolvins and turn off inflammation and heal injuries, a person must have a reservoir of EPA and DHA in the bloodstream because resolvins are made from those two essential fatty acids. Now, resolvins don't circulate in the blood, so they can't be measured directly using regular blood tests. However, since resolvins are made from EPA and DHA, the blood can be tested for those fatty acids to get a very accurate indication if a person is capable of making resolvins when needed. The EndFlame blood test measures EPA and DHA 2 ways. First is the omega-3 index, and second is the omega-6 to omega-3 ratio. Now, this chart from a leading pathology textbook that doctors study in school shows the various outcomes that occur when you sustain an injury. The top left diagram is a drawing of newly injured tissue. If you have sufficient EPA and DHA in your bloodstream, the body will make resolvins and the injury will heal with complete resolution as shown in the diagram at the top right. However, if you are deficient in EPA and DHA, your body has no choice but to go into plan B and heal the injury using scar tissue that turns chronic as shown in the diagram at the bottom left. Now, if you continue to remain deficient in EPA and DHA, eventually the chronic inflammation becomes fibrotic that creates a loss of function as shown in the diagram at the bottom right. Here's a sample report like the one you'll receive of the first EndFlame test called the omega-3 index. The blue circle at the top right shows this patient's lab findings to be 5.75%. The normal level is 8 to 12%, so this patient is deficient and needs to raise his EPA and DHA in the blood to make resolvins and shut down inflammation. This is a sample report of the second EndFlame blood test, the omega-6 to omega-3 ratio. This ratio indicates the body's ability to turn off inflammation and prevent scar tissue from forming. It also indicates a person's current risk of developing a chronic disease. Now, this patient has a ratio of 6.8 to 1 as seen in the blue circle, where an ideal ratio is 3 to 1 or less. This slide shows how common it is to have an omega-3 deficiency. All the areas in red, which is most of North America, have a very low omega-3 index value at or below 4%. The normal value, as I said before, is considered to be between 8 and 12%. In closing, Harvard's research found that inflammation heals actively, not passively. And the active healing involves having an adequate reservoir of EPA and DHA in your bloodstream. In order to get the most from your care program, your healthcare professional may suggest you test your blood using the EndFlame test, and if found deficient, recommend the EndFlame program. This is Dr. Don Hayes, DC, saying, hey, thanks for watching, and bye for now.